it's commercially in their best interest to do so, because it's a lot easier to say, okay, you've got these 5 symptoms, you meet criteria for depression. I know nothing about your life, but you meet criteria for depression. And don't worry, there's an FDA-approved treatment for it. Take this drug, I'll take $500 and I'll see you in 3 months. And when I see you in 3 months, I will not ask you about things in your life. We'll talk about whether the drug dose goes up, down, or stays the same. That is the experience a lot of people have these days. And one of the big issues is, like you had mentioned a moment ago, Dave, that's how psychiatrists differentiate themselves from other professionals in the mental health care space, that they use the drugs. And so they are very hesitant to ever talk about some of the huge gaps in research. For instance, that none of these drugs are studied any longer than a year, and we have no clue really what they do long term.
I'm Dave Rubin, and joining me today is a board-certified psychiatrist and founder of the Taper Clinic, Dr. Josef Witt-Doerring. Welcome to the Rubin Report.
Hey, Dave. Thank you so much for having me.
Well, I'm glad to have you. I've been seeing you make the rounds on social media. You keep popping up on my Instagram, doing something that I'd like to talk about other than politics for a moment, which is mental health. It seems to be, let's say, on the precipice in America right now. What's going on with mental health, the general state of mental health in the country at the moment?
Well, the general state of mental health is poor. In fact, our levels of depression are the highest they've ever been. The suicide rate is very high right now. It's the highest it's been in 20 years, and it's been steadily rising. And the curious thing about all of this is these mental health care outcomes are worse, but we're using more psychiatric medications than ever. And that seems a little bit counterintuitive to me.
Yeah, so that's basically your area of expertise, that there seems to be a disconnect between these things. We're prescribing more drugs, which are supposed to make people less depressed, and yet people are more depressed. Well, maybe before we dive fully into that, if you could just give me a little bit of your background. So for someone that hasn't seen you before, they have a sense of where you come from, that accent that is clearly not American, and what brought you into this. And then we'll get into the specifics.
Okay, so I'm originally from Sydney, Australia. I did medical school over there, came to the US and studied psychiatry at Baylor College of Medicine. And after that, worked in the pharmaceutical industry and the FDA, and specialized in the research behind psychiatric medications. And throughout this journey through psychiatry training and the pharmaceutical industry and the FDA, I noticed that we really aren't helping people with their mental health care problems. And it's a mixture of things. Some of it is the pharmaceutical industry, which has a huge influence over controlling the narrative about the drugs. But then there's also just economic factors where, in order for doctors to make ends meet, you have to see 4 patients an hour. Now, it's this combination of things that has led to a state of affairs where we pretend that we can help people with serious mental health care problems that require a lot of understanding and a lot of effort to help with simple drug solutions. And as I dug into this more and more, I actually believe in many cases medications are making people worse, and the overuse of these drugs is actually fueling the mental health care crisis. And so that's a little bit about what I'm about. I also have a medical practice, which I've run for 5 years, helping people come off the medications using non-drug alternatives. And those are the things I like to talk about.
All right. So to that point, and now to connect it with some of what you just said. So depression is up, suicide is up, and yet all the prescription stuff is up. How much of this would you say is the fault, perhaps, of talk therapy, that so many people turned to prescription as opposed to working it out old school on the couch?
Yeah, so I don't think it's the fault of that. Where I really think things have fallen apart is that we don't really investigate the reasons why people are unhappy. In mental health care these days, it feels like there's 2 options for people. It feels like if you're having a problem and it's related to stresses in your life, go and see a therapist. Now, there are a lot of people out there who feel very anxious and very depressed, and it's quite serious, but it's completely out of context to the stresses in their life. Now, traditionally, well, not just traditionally, right now, most doctors, when they see those patients, they say, you have a chemical imbalance, there's something wrong with your brain because we can't explain it with your life, and so you need to go and take a drug. Now, there's another category in there that is constantly overlooked, and it's going to seem so self-evident. A lot of people are feeling shit because they're not looking after their health. They're eating bad food. They're not moving their bodies. They're smoking cannabis or drowning themselves in stimulants and all of these things. And so we've completely ignored very common sense things. We don't investigate it, and we end up just putting a whole bunch of these people on medications while the underlying issues aren't really being addressed.
So is also part of that, and you address the sort of selective pressures. They have to make money. You have to bring in a certain amount of clients. But if you go to a psychiatrist today, if anyone watching this walked into a psychiatrist today, they could pretty much walk out with a prescription for almost anything because that's what the psychiatrist is there to do. They're not there to either talk it out, right, or do some other thing. They are there to prescribe drugs ultimately. So unless they are going to say, no, I can't help you, go somewhere else, thus I'm not going to make any money off you, they're going to give you something.
Yeah, and usually it's commercially in their best interest to do so because it's a lot easier to say, okay, you've got these 5 symptoms, you meet criteria for depression. I know nothing about your life, but you meet criteria for depression. And don't worry, there's an FDA-approved treatment for it. Take this drug, I'll take $500 and I'll see you in 3 months. And when I see you in 3 months, I will not ask you about things in your life. We'll talk about whether the drug dose goes up, down, or stays the same. That is the experience a lot of people have these days. And one of the big issues is, like you had mentioned a moment ago, Dave, that's how psychiatrists differentiate themselves from other professionals in the mental health care space, because that they use the drugs. And so they are very hesitant to ever talk about some of the huge gaps in research. For instance, that none of these drugs are studied any longer than a year, and we have no clue really what they do long term.
What do you make of the amount of drugs that have been prescribed to young people? And I'm talking probably almost to preteen, right? I mean, the amount of ADHD stuff and all of that we're basically hooking a generation of young people onto things before they can even make any decisions about what their mental health should look like, or before they're even able to view it from an adult perspective and say, oh, I don't necessarily want to be drugged for the rest of my life. I'm going to guess if you get on some kind of ADHD thing as a young teen, getting off that when you're early 20s is going to be pretty damn, if not totally impossible to do.
Yeah, I mean, it's really challenging. I mean, there's also a lot of very concerning data about the effects of exposing young people with maturing brains to drugs. I mean, there's a huge amount of just neurological maturation during that period. And if you start putting chemicals in there that alter neurotransmitters, you end up with, you disrupt the normal trajectory of development. And we see that in MRI scans. We also see it in brain activity in the amygdala, which is the area responsible for fear. And it does seem like some young people, especially exposed during their mother's pregnancy, so in utero during that period, that leads to different outcomes. But the amount of psychiatric drug use right now, it's substantial. I mean, it's about 5% of kids are on antidepressants, about 6% of kids are on ADHD medications. So if we're talking about a classroom of, 20 people or something like that, that's like 4 kids. It's a sizable number of them are on some psychiatric drug nowadays, and I just think mental health is complicated. I don't want to make it seem like it's as simple as just diet and exercise. Obviously, if someone's in a traumatic household, a parent has mental illness, maybe there's some abuse that needs to be dealt with therapy and social services. But there's a lot of kids who are having concentration and behavioral issues or, normal sadness that we're missing all of these opportunities for non-drug approaches, which are very effective, and we're putting them right on medications.
For more insightful conversations on how to live the good life, go to our lifestyle playlist. And if you want to watch full interviews on a wide variety of topics, watch our full episode playlist, all right over here. And to get notified of all future videos, be sure to subscribe and click the notification bell.